Alright, we got the shoulder blades, or scapula. We got the left scapula and the right scapula. They both got the same structures, so we'll just go with one. Here we have the anterior surface of the scapula, and this is the posterior surface of the scapula. We'll start with the anterior surface. So up here we have the superior border of the scapula, and if we follow it down, we'll meet this little notch here. This notch is called the scapular notch, and that contains a nerve that innervates the shoulder muscles. If we keep going up, we reach this process here. This process is called the coracoid process, not to be confused with the coronoid process of your ulna. Very different. This is the coracoid process of your scapula. Now over here we have this shallow depression called the glenoid cavity. And the glenoid cavity is actually the site of articulation with the head of the humerus. So you can imagine the head of the humerus fits nicely into this cavity here. Now right below the glenoid cavity, we have what's called the infraglenoid tubercle. Okay, infraglenoid meaning below the glenoid. And the infraglenoid tubercle is actually going to serve as a point of muscle attachment for the triceps brachii. Okay? Over here, this little depression is called the subscapular fascia. Alright? And in terms of orienting ourselves in the body, this is going to be the medial border, and this is going to be the lateral border. If you flip it over and look at the posterior side, this structure here is the acromion, and it's located directly posterior to the coracoid process. Okay? If we follow the acromion down to this ridge, this is called the spine of the scapula, the scapular spine. Okay? And just above the scapular spine is the supraspinous fascia. That's what this depression is called. Okay? Supraspinous, above the spine. Below the scapular spine, we have another fascia. This is the infraspinous fascia. Infraspinous, below the spine. Okay? And we also have some angles that we can look at. So on the medial side, we have this angle here. This angle is referred to as the superior angle. And on the lateral side, we have the lateral angle. Okay? And on the bottom, we have what's called the inferior angle. And in terms of bony structures of the scapula, that's really all there is to it.